From KETK, you're watching East Texas Live.
And welcome back to East Texas Live here on KETK. Joining us now is Carolyn and Jackie, and they're here to tell us about the upcoming East Texas Human Needs Network. How are you guys doing here today?
Fantastic, wonderful. Thank you.
So what's going on at the Human Needs Network here in East Texas?
Well, today we're here to tell folks about a symposium that we are hosting on July the 18th. For the past year, we have partnered with the School of Medicine, the University of Texas at Tyler, and their School of Health Professions to conduct a comprehensive community needs assessment for Smith County. And we're unveiling our data on July the 18th at the Brookshire Conference Center from 12 until 2. And we'd like the public to come to hear what our neighbors have specified as their most important needs.
Yeah, what else is going on with this at the moment? What other things are you guys, what else is happening with the charity?
Well, one of the things we're doing is being really intentional about community partnerships, and that's one of the reasons why we're partnering with the School of Medicine. And Carolyn can talk a little bit more about that.
Well, part of our effort and part of our missions is really to be engaged with the community and really figure out how the School of Medicine can be a resource. We know that in the survey itself there were areas that looked at social determinants of health, housing, transportation, capacity to pay for resources, and so some of those responses from the 376 members who replied to the survey, all within Smith County, gave us some really interesting data to identify where those needs are, and it gives us some insight as a School of Medicine about how and what ways we partner and what the issues are.
Some of the needs that our neighbors identified were anxiety and depression. 44% of the folks that we surveyed said they are dealing with anxiety, need help with that, and 38% of the folks that we surveyed said they are dealing with depression. So we can see that depression and anxiety are things we really need to work on together as a community, but 37% of the folks we surveyed said they're having trouble paying their bills every month on their own. And then another one of the needs that folks identified was access to affordable prescription medications. So lots of folks can't afford their medicines. And then almost 30% said that they're having trouble being able to afford dental care. The next top need was access to a primary health care provider. A lot of the folks that we surveyed said they're having trouble getting a doctor.
Yeah, and with all these needs at the moment, how important is it to continue to reach out to people that really are struggling with these types of things here in East Texas and continue to make a difference?
Well, one of the things we believe at East Texas Human Needs Network is that we're better together, and it's when we come together and collaborate with each other that we can best address human needs. So we meet monthly and we divide ourselves into councils so that we can talk about how we work together to address some of these needs that have been specified by our neighbors.
Yeah, and finally, in the future, what are some other things you guys hope to accomplish?
Well, we hope to continue to increase our membership. Ethan already has over 100 community partners that are members, mostly nonprofit organizations, but we want to continue to increase our membership. And then we want to continue to be intentional about creating projects together to address what our neighbors have told us are their most important needs in the CCNA. We don't want to just guess. We want the data to inform all of the work that we do, and we hope that over time we'll see these numbers go down because we're doing a good job at addressing them together.
Well, thank you both for being here and what you guys do for the community. It's really, really appreciated.
Thank you.
Well, back with the second half of KETK's East Texas Live in about 2 minutes. Stick with us.